Welcome everyone to the International Myeloma Foundation's Living Well webinar on telehealth, how to make the most of your healthcare provider visit. I'm Robin Toohey, Vice President Support Groups of the International Myeloma Foundation, along with my dear friend and colleague Diane Moran, Senior Vice President Strategic Planning. It's our pleasure to welcome you.
Good evening. As the IMF continues our commitment to bring you the best education and the most high quality education in a very timely manner, it is truly my honor and pleasure to introduce our very distinguished speakers this evening. This evening you'll be addressed by Dr. and Dr. Faiman, and they are active practitioners and worldwide lecturers on topics that include telehealth and myeloma. Beth Faiman, Dr. Beth Faiman in particular, is near and dear to my heart because she is one of the founding members of the International Myeloma Foundation Nurse Leadership Board. She's a nurse practitioner at the Cleveland Clinic Taussig Cancer Institute. And so again, it's my pleasure to welcome her. And also Dr. Matt Faiman. I'm very happy to introduce him. He's the medical director of Express Care Online at Cleveland Foundation. And since 2005, Dr. Matt Faiman has been involved in telehealth and developing innovative ways to apply telemedicine to the clinical programs at the Cleveland Clinic and to share those learnings around the world. So it's very unique opportunity to have Dr. and Dr. Faiman. And so we welcome you and we thank you for all your service and your passionate care of our patients and caregivers around the world.
Thank you, Diane.
Thank you.
Okay, so everyone, before we get started with both our doctors here, there will be some time for questions throughout and then at the end of the presentation. So if you do have a question, please type it in that question box and we'll get to as many as possible this evening. I'd like to also take this opportunity to thank our sponsors for their support of today's webinar, and that's Bristol Myers Squibb, Janssen Oncology, Oncopeptides, and Takeda Oncology. It's now my pleasure to turn this call over to Dr. Beth Faiman.
Thank you so much, Robin. Thank you, Diane, and thank you to all of you who are listening to this telecast. I was telling Diane and Robin before, I'm passionate about multiple myeloma care, and Matt is passionate about telehealth and innovative ways to connect people and providers through technology. And so hopefully this will be a light discussion tonight. We're going to share some practical tips on how to prepare for virtual appointments. You heard who Matt is, and you know who I am. And thanks again for joining us. So this slide here is what we hope to accomplish. Again, these slides are loaded in PDF form for you to access, download, and share with your support groups or friends or family if you're interested. So we'd like to do an overview of telemedicine and virtual care. We'd actually also like to discuss how to use telemedicine in your routine care and how do you prepare for telemedicine visits. Should this be different than your regular visit? So those will be asked throughout. Again, as Robin mentioned, if you have questions that are burning during the presentation, just to allow the flow, type it in the little box that's on the side of your screen. Otherwise, we'll have time for question and answer at the end. So just to provide a brief overview of telemedicine, telehealth, we use these terms interchangeably. Basically, telemedicine uses video, images, and audio sounds to evaluate, treat, and assess patients whose location is different than the evaluating provider. So in my little den area, in my house, which is where we are right now, we can see you all across the United States and other parts of the world even, which I think is so wonderful to have that opportunity. I do a lot of these visits from my office, but you can be anywhere. It's currently a way to connect by internet, smartphone, and telephone, and we'll talk later on about the different ways we can connect and which is better than the other. The benefits are less travel. You can still have that face-to-face encounter and phone visit. It's so much safer with COVID to stay in your little bubble. The downside, technology issues, and of course it's not in person, especially when you might not be prepared to hear some bad news. It might be a little bit more difficult for us to convey empathy and answer your questions depending on how you're connecting, and we'll address that again later. So in terms of technology and the potential to connect, I think a lot of us, look at all of you who are joining us tonight on this webinar, and many of you probably did not have knowledge of this technology platform before the pandemic, and now we're like Zoom experts, right? And we're changing our backgrounds to make it a little bit more broad. An earlier survey this year was in June. It said roughly half of adults say the internet has been essential to them during the coronavirus, about 53%. Many said it's important but not essential, but look at that, 87% of people altogether thought technology, period, was important. Many older adults need knowledge, education, support just as much as others. And again, technology gives us the potential to connect, but that doesn't mean we're capturing everybody. We do have a lot of internet users, 313 million in the United States as of June this year, and 85.8% have the potential to access internet. So that's better than a lot of other countries, but are people actually accessing them? And if they don't have the internet, there's 274 million mobile internet users in the United States. So there is the ability and the potential to connect us. I'm going to take a pause there, and we have one polling question just to interact with you and see what you thought. Miko, would you like to launch this polling question? The poll is going to be, oh, organizer must close this so I could do this. Okay, hold on. Hope I do this right. The red arrow at the top. Got it.
Does that work?
I didn't do it right, I don't think.
I think you need to.
Well, we can skip the polling question.
Well, if you can maybe, yeah, maybe try that.
Hide
See
the control view. Okay.
if that works. See, we're all, even us, I've been doing this for so many years.
We're giving a lecture. We can't even figure it out.
We all learned about technology even while this happened. And I want to make sure that if there's a way for us to see that this polling question is going through. And
That's okay.
I have a follow-up to this polling question, actually, and I joke. By way of a show of hands here, and I say this really jokingly, me included, how many of you actually have a mobile phone? Of course. So over 91% of people will, or 90% of people will have a mobile phone. And to Beth's point about mobile internet users in the US, 274 million, it's well known, and the use of mobile technology really makes the fact that telemedicine is here to stay is really important. A scarier fact might be that 91 or 92% of us have our cell phones or mobile phones within arm's reach of us 24/7. So we sleep with it, we eat with it, we do everything with us. And that's one of the reasons why it stays with us. But this is one of the reasons that we stay connected, and it is a potential. And so, you know, I obviously can't see everyone's hands, but I'm sure all of you had your arms up in the audience. So we'll continue.
We'll continue. I'm not sure if that Robin or Miko, can you let me know if you are we doing the polling?
Oh, yeah, we just finished the polling, and then 79% says it's yes. They have used telemedicine, and 21 said no.
Great. 79% of people said yes, they've done virtual visits. Isn't that wonderful?
Well, thank you, everyone. I'm just going to get off. I'm kidding.
No, you stay. With that, I'd like to take a brief moment for Dr. Faiman and Matt to go over the history of telemedicine. He always likes history. Yeah,
you know, so I'm the one who, maybe it's my Canadian background, but I always find this interesting. When we think of telemedicine, we always get maybe hung up on the fact that this technology, people get overwhelmed and checks and all this, and then people get flustered, and then something happens and it doesn't work. But just thinking back that Alexander Graham Bell, you know, brought this wonderful thing called telephones, and we still use telephones. And in fact, we'll talk about the use of telephone for telehealth and what its role is. It's been around. Obviously, we use this, and many of us expect when we go to doctor's visits and nurse practitioner visits, there's an EKG that we're still using. That is a form of telehealth. Tele-EKGs can be used remotely, and we send these electronically across the world. Obviously, there was a gentleman, Hugo Gernsback, back in the 1920s. He was actually the father of some of the thoughts around some interesting things here. He talked about the doctor of the future. That was way before the Jetsons, which, you know, is sort of my generation of what we think about when it comes to the doctor of the future. And yet there it was for us to all see that this was a form of telehealth way out there. Fast forward 50 years, the airport of the future, Mass General and Logan airports, having someone available to start doing telephone visits. They staff this 24/7 to provide two-way audiovisual microwaves circuitry. And then it led into much more recent things like the 2000s, where with mobile technology, emails, telehealth, remote monitoring, that's where we are now, until obviously this thing called a pandemic, which obviously escalated where we are, and the fact that we've all sort of had to jump in and embrace telehealth. And so 100+ years of technology with the advent of where we are, plus you add in a pandemic, spells where we are going to be going with telemedicine. Where is it headed? So, you know, thinking about it in three different areas: the benefits of telehealth to the healthcare system, the benefits to the patient, the benefits to the provider. I want to just sort of briefly talk about why it's important and how it can be utilized, and thinking about it that from a healthcare system, you know, it's very important, especially in a pandemic, but even just, you know, thinking about it from the utilization, that earlier access to healthcare really provides an opportunity for the healthcare system. And providing the opportunity to get access earlier may provide less sick when needed and when seen, so that's kind of important. And sometimes, to be honest, reducing avoidable in-person care. Like I was taught now more recently, many healthcare decisions actually happen with women making 2/3 of all healthcare decisions, which is very important when we think about this, especially the marketing people who work in our healthcare teams, but also the fact that a lot of healthcare decisions actually may not happen in the traditional way that I was taught in medical school 25 years ago. That it's not, you have to come to the office, you have to get your diagnosis, you have to get your treatment, and everything has to happen there. In fact, a lot of things actually may happen outside the visit, when you get testing done, when you get dialogue, when you get communication. And so spending fewer sick days away and loss of work really can be a benefit to the healthcare system in general.
Of course, you were trained in Canada and they're free for service, so you don't get paid in Canada unless you see the person.
No, that's true. Plus, it seems like, you know, all of Canada is relatively rural, since other than being maybe 70 miles from the border, once you go beyond that, and Canada is a really big country, everything is rural. So in a lot of ways, rural care became a gateway towards telehealth care. So maybe I'm biased. But having said that, when you think about the clinician, you know, someone like me or someone like Beth, as we think about caring for our patients, you know, we can care for our patients anywhere. Sometimes we do. In fact, you know, I joke, or the people in my office are like, are you taking care of things at 35,000 feet? So sometimes we handle our messages because we have an electronic health record. We use something with MyChart, so we can handle messages with our offices and with our patients, and that's a form of care. But there's also this capability for, you know, we can be here at home, but I also have a medical office here, and I can arrange virtual visits and care for my patients who are hundreds of miles away from me. And that's really an ability for us to access their history while they share it with me, but also access it from their, you know, their medical chart, because I have access to it. And probably most important, and what I'm passionate about, is, you know, what benefit is it to my patients? You know, there's so many things that I think about as a patient, you know, the empathy, the journey of the patient, and the fact that patients really want to spend time with their families, spend time at home, spend time living, and not have to spend time waiting in offices, waiting for Dr. Faiman when he's already 30 minutes behind when the day already starts. And so skipping long lines in office rooms, not having to be, you know, contagious around others, the appointment offices, infection control, easy access to care. These are some of the cited reasons. I think these are parts of the reasons. Plus, you know, there's something comforting, you know, if you have a rapport with the provider, when you can see them at home, when they have their pets sitting on their lap, when you can, you know, even ask them to show you what's inside their fridge, because sometimes people tell you, hey, you know what, I'm really eating healthy, Dr. Faiman, and then you look in their cupboards and you go show them the Halloween candy that they claim is diabetic, friendly. And then I say, those Hershey Kisses look really good. So you start to learn some really interesting things that you may not have actually learned otherwise.
It can connect even better, I think, sometimes when people are at home versus in the office. It's a little bit more relaxed. They're in their environment and you're in yours.
Yeah, correct. And then finally, I think it's important as an employer, and we all have to think like this, and we as the collective because unfortunately, the reality of where things are and the challenges that we faced with, particularly in this pandemic, where millions of people are reliant on unemployment, and we've had issues around loss of job, is that a quarter of private workers cannot, earn paid sick days for care for themselves. Plus, you add in high deductible plans, and the fact of the matter ends up being that it makes sometimes a lot of sense for an employer to enroll their patients in virtual care, because the cost to the employer really makes sense. If they can have their own employees not spend time in the emergency room and have access to care really 24/7, it really makes it so that presenteeism, the ability to stay in the in your workplace because you didn't have to get that test done and avoid care because your back didn't get thrown out, and you're able to seek care when you need it, really makes the value proposition to everyone that much greater.
I totally agree on the benefits, but I think in myeloma patients, right, I think this is a bigger benefit. Dr. Joe McHale, we were just talking on a webinar last couple weeks ago, and he says he's done more remote visits than he ever did before because of the pandemic. Now, how do you see people access, like how could I, if I was a myeloma patient, how could I access telehealth visits?
Yeah, so great question. So we think about, one of the hats I wear is in this sort of, I'm sick today, I think I might have COVID, I would do a virtual visit. So that's sort of been the traditional model of care, but it's as important, if not more important, for the continuity of, I might have a chronic condition and I want to seek care, particularly at a place like, we're blessed to work at the Cleveland Clinic. So I want to get an opinion. And so I think it's as important to be able to realize you can do that. Telehealth allows it. The CMS and the Health and Human Services really relax the rules around you can seek care, you can get opinions.
Even out of state? Even
out of state. So I always look at it this way, and this is like a hat I have to wear all the time. It's always important to know the rules in your state and know the rules out of state. And me as a doctor who has licenses in different places, I know what can be done, but you also need to know that we always think about you establish a relationship with the patient, often in the office, and then seek care to have those virtual visits after. But at the same time, it can be done. The rules have been relaxed to say you can get these consultations done within your state, and we have people driving 5-6 hours just from Southern Ohio to here in Northeast Ohio and get those valuable consultations. And there is ability beyond and cross state borders to get consultations, and it's important you check on that. But I do think for a patient with myeloma, if you want to get that opinion, it's your right to think about, I should be able to get that care. And instead of driving all that way, you get that through a virtual visit to start, and then decide to establish that care at some other time.
That's great. Hey, Robin, I don't know if you're there, if there's any questions, or should we move forward through the next section?
Sure, Beth, thanks for checking. So I do have a good question from Todd Kennedy, and he asks, having a myeloma expert on your team has been recognized as a key to long-term success. Telehealth provides patients with new access to specialists, especially in this age of COVID-related travel restrictions. Unfortunately, current state laws may prohibit patients from receiving a telehealth consult from physicians outside of their state. So what do patients need to know about out-of-state telehealth? Are there any myeloma centers of excellence that provide telehealth to patients regardless of their state of residence?
That's an excellent question, and we can touch base upon this later too. I can speak to my personal experience. At my institution, you can do a telehealth consult. And as Matt was just mentioning, they did relax the guidelines at least up until the end of this year, and hopefully it'll continue, where you should be able to do a telemedicine consult. So not going in, and most states and most insurances are allowing this. Now, it's a loss of revenue to some institutions because they're not getting a lot of money for that telehealth visit compared to what they would, but companies like me at the Cleveland Clinic and other institutions, they value you wanting to come there. That's good for them to have that extra person, the word of mouth. So that will oftentimes offset. And I don't know if you have any quick briefs before we move on.
Unfortunately, it's a very thoughtful question, and it's a challenge that all health systems have to wrestle with. To some degree, it is dependent on your insurance. So some people have commercial insurance, you can pick any one of the commercial insurances. And the challenge in some ways is that if you have, pick an insurance of wherever. So Anthem of Ohio may be different than Anthem of Pennsylvania or Anthem of Michigan. And so you often have to actually check with your insurance carrier to say, what are my telemedicine, what plan benefits do I have for telehealth, and does it include consultation for a provider who's out of state? And the answer may be yes, no, maybe. CMS and Medicaid have slightly different rules. So sometimes the burden is a little bit on you. There isn't a website that says I can search this, but in many cases, you do have the ability even to choose to get a second opinion. And many times you look at it as a patient and say, for me to arrange travel to another place, to look at lodging, gas, responsibilities for my family, it may be worth the small fee just to kind of arrange to get that opinion up front and the time, and then decide that, yes, this is the place to do it. So some of that becomes much more transparent actually with telehealth when, to be fair, you might even not know what the cost of the CAT scan is in your institution if you were to get it tomorrow until after you get your explanation of benefit. So telemedicine in some ways has pushed the transparency factor ahead.
Yeah, for sure. Well, I think we'll just continue on the discussion in the next section. I don't think I need to share any more of the benefits of telemedicine in routine care or any care. It's fast and convenient, and now it's secure. One of the things I'd like to highlight to patients, and Matt and I both, we train people in our profession to do examinations. And so depending on what your concerns or your questions are, you might not necessarily need this, but yes, you can have examinations. And we use the example of, you have a spot on your skin, and if I'm using my smartphone, I can take a picture, I can share it. The phones are very nice. If I'm having swelling in my ankles, I have people, bring the camera down to their ankles, but you really would be surprised what you can see and hear. If somebody's calling because they are worried about having a pneumonia or infection, I can have them come close to the camera, listen to their lung sounds. I can even sometimes hear wheezing, etc. So this can drive you, even a limited exam, to an ER visit or an urgent visit versus otherwise. In terms of familiarity and feeling comfortable, these are some of the quotes that I've heard from people that I work with. Once the camera was on the laptop, was brought down so I could see him, it was almost if we were meeting in person. And being skeptical, but the first visit being handled was very pleased. It's funny because I have so many people that in the office, I'll say, next time, let's connect digitally. I'll sit there with them and I'll show them how they would connect and what that would look like in the office. So ask your patients, ask your providers too. And that brings the next question about telephone visits.
Sure. So thinking about, Alexandra Graham Bell would be delighted to know that the telephone does serve a great purpose. And thankfully, again, COVID-19 expedited the fact that most insurances have taken their cue from Medicare, and Medicare looked at the fact that, to be fair, there is a digital divide in this country, and as good as connectivity is, there are some places, quite frankly, that just don't have it. And so not everything can be video, and as much as I like to look at someone and I can assess someone looking at me and I can see if someone's in distress, I also can hear if someone's in distress. So I can hear if someone's huffing and puffing, and I can hear if If they wheeze, I'm an asthmatic, so you can hear when I'm wheezing. So telephone visits are actually covered, and Medicare has made it clear that they will as a means to at least allow that. And there's plans to be at least pushed into, once the pandemic period, is over. And so that's really sets the pace for moving the laws around what's going to happen in telehealth care.
So if you're really worried about connecting by internet and you just don't feel confident that that is something you can do, or you don't have an internet connection, then you can absolutely use your phone in many cases. I still think it's better to connect virtually over the phone than not to connect at all.
Right, and as we've said, even if we have to send you in, I'd rather be able to talk with you and see you, because at least I can triage you, and oftentimes with video, because body language tells a lot, because I could be smiling and tell you that I'm short of breath, but I also could be huddling and shivering, and you can see the body language that you may not hear as much with the telephone. Not to say that the telephone isn't the way to do it, it's an option.
Absolutely.
Excuse me, Beth, it's Robin.
Yeah. Ooh. Hi, Robin.
Hi, sorry to interrupt, but Matt, would you just pull your chair in a little bit closer? You're a little bit hard to hear.
Oh, sure. Okay, can you hear me better?
Yes, much better, thank you.
Okay. Terrific.
Oh, thank you, Robin. We're in our little bubble here. We don't know what we can hear or not. Yeah. So what to consider before the visit, I'll just go super quickly through this. Most places where you seek care, and I'm sorry these say Cleveland Clinic, but this is what we use, they have patient guides, patient playbooks, patient handbooks. So each healthcare system has this. Again, if you're in a rural area and you want a consultation with a specialist, go to their website. A lot of the misconceptions is that you need a referral, and you oftentimes don't. So the myeloma answer line is a good way to look, but like Matt said, call your insurance. Sometimes it's a nominal fee. You'd be surprised how inexpensive some of these services are, and it offsets the travel. Before the visit, you will get mailed instructions in most cases. We've talked about the iPad and the smartphone. You can kind of move it around. Computers, just fine though if that's what you have. But read the handouts that they have given you and do a little bit of a test run. Again, reading and answering questions ahead of time. So a lot of times there'll be a phone number to call. If you're setting up the app or downloading Zoom or whatever on your computer, they'll have phone numbers for you to call to ask of. This is my checklist for what I tell people, and I got a lot of this from Matt. Find a quiet, comfortable space, locate and check the links that they work, find out any costs of the visit, look at the back of your insurance card and you can call that, or you can call the place that you're having the appointment through. Call the scheduling desk and say, how much is this going to cost? A lot of times they can look at your insurance and know. What are your other tips on here you like to share?
Yeah, it always helps to be prepared. It's no different than if you're coming into person, like face-to-face, brick and mortar, as I call it. So there's a good set of value to realize this is new for everyone, even for a lot of the healthcare providers. Like, I'm experienced doing this, so we're trying to make this lighter. Some people are nervous about it, but try to relax. If you get flustered and everything, then your body language looks flustered. So take the fact that this is just a technology tool to help you, share why you're there. So you have things that you're there to discuss. You may have results you want to go over. You're feeling vulnerable, but now you have home turf advantage here. So take advantage of this. So make sure you're prepared and understand that there may be some things that you're being asked of, and you can prepare usually in advance. Some of the tasks may be done up to a week in advance, and some you have to do like the virtual check-in up to an hour or 15 minutes before, and then you may decide that, I have to wait, just like I have to wait every time I see, Faiman in the office. He's always running behind. Well, guess what? And it's no different virtually. It's
at least you're on the couch though, when you're waiting for him.
At least I can multitask at home. So there is some, there's some value in that you have the capability again of having a field advantage.
Yes, for sure. And I think there are a lot of tools on the myeloma.org website for preparing for an office visit. There's also, I know, Myeloma Canada is as an affiliate of the International Myeloma Foundation, but they have lots and lots of resources, and I hope that IMF doesn't mind that I give them a shout out, because this is just an example of the resources that they have, such as if you're experiencing fatigue, record your energy level. On 0 to 10, what's your energy level, your pain? 0 to 10, what's my pain today, and what am I doing? And again, during your treatment, you'll have lots of needs and lots of questions. So keep a book handy or a notepad handy so that you can use it. But getting a little bit more detailed, this is my checklist that I like to share with patients. If they're going to be coming in. So for example, prepare a list of questions like we talked about, and bring a pen or a pencil and paper, and keep that handy so you can take notes, just like if you were in an office visit. Don't forget to get your labs tested or test results, and ask about test results. And we'll follow up on that in a moment. Make sure to review your medications and side effects. Some of these platforms that you log into will ask you to review your medicines, and some will not. But make sure that you know what you're taking and share it with your provider. If you have high blood sugar, record and write it down. If you want to take your temperature, blood pressure, blood oxygen levels, if you have a little clip on your finger, that's great too. And confirm your follow-up appointment before you hang up. Know what your plans are. Am I meeting virtual? Am I meeting in the office? And when? Beth?
Right, and so to tag on that, some of the nice features that I've found over the years is that I can get people's own blood pressure cuff to upload their readings right into their own chart, so that I can follow along, so that if it's the rib cook-off that weekend and they decided that they ate too much salt, I will know that their blood pressure spiked that weekend, because I will have that in advance of their appointment. And then we can do a polite discussion around what is salt and maybe why salt may not be good for them. And so getting that information ahead of time is very, very helpful. So again, weighing yourself on the scale, whether you want to see that number or share that number, that may be something, again, important in advance of that appointment, because just like you would have that done in the office. Other important things are eliminate distractions. As much as I hate to say this, people are driving their cars and trying to see me for virtual visits, and as much as we want to be connected 24/7, it might not be the most safe way to connect. The other piece of the other side of the coin is when we have a visit, sometimes you're inundated with so much information, especially if you're having an important discussion around treatment or treatment changes or an important result. That one thing at home to have a caregiver brought into the conversation, but sometimes that caregiver is at another part of the city, or maybe it's a loved one that lives somewhere else. We have the ability with these virtual visits to invite, it's like a three-way conversation. You can invite someone, and it's HIPAA compliant, it's safe. They can be participating just like we're in a group conversation today. And then that way you have you've got an extra pair of ears listening. So I think that's really, really important. Making sure, obviously, you log into your visit, because we will call ahead. We will have our nursing team or our assistants check ahead and say, have you logged in for your visit? Because you might think you're ready to go, but you haven't actually hit the login. So that's an important. And then, of course, I call it the website manner. Like I know sometimes that I have to look at the camera to make sure I'm looking at the audience or looking at my patient, as opposed to looking down here. It doesn't make for good rapport if I don't look like I'm looking at you, because then it doesn't look like I'm giving you my attention. And it's important just to make sure that we have that. So it's very hard sometimes to think about, there's so many things going on, what's the right thing to do. At the end of the day, just relax, let it happen. You'll talk, you'll know who your provider is, you'll have a conversation. And so when connected, obviously say hello. Sometimes we all tend to wave a lot on these things, and I do it too. But making sure you can see each other. I often will ask and make sure that I have the right person. Obviously, I know who they are, but I will make sure they're where they say they are. Sometimes people are traveling, they're on vacation, which I'm envious of. And we have to level set expectations to make sure that if I know their agenda is this long, what questions they want to get out of it. And then when we get to the physical exam, I do remind them that I may have them come really close to the camera and look to the left and right and up and down and stick their tongue out. And it seems kind of silly, but it's very helpful for me because it may help me make a different diagnosis. And then we take our time. I will use my camera sometimes to share something on screen. I can flip things around. I can share results. And I think that's important. I've shown people their x-rays, which they've never seen before, showing them the broken bone and showing them what that looks like. Sometimes they have time in the office to see it, other times not. So making sure you can do all that, address their concerns, pressing on their sinuses, all those kind of things are really makes you connect to the visit itself. So I think those are some of the things that I think are important in preparation.
Right, I totally agree. I think that setting expectations and asking, asking the patient what they want out of the visit at the very beginning is important. I think it was brought to my attention, one of the concerns is, I take it for granted. I ask my patients oftentimes to get labs ahead of the visit, like a week or two in advance. And then there's that anxiety. What did my lab results, what did they show? Did you get my lab results? And what are some of the things that you do because you do that too in your field? Right,
correct. So it does provide a great deal of value. Like I have a lot of patients who have chronic conditions like diabetes, hypertension, chronic kidney disease. And it's important. I need a urine test. I need a blood test. The interesting part is that it has, a give and take here. And so I have a relationship with the patient that sort of says, the results are going to be ordered, but you may see them in advance of your appointment. But no, we're going to have an important discussion. But it does provide anxiety. Congress passed some rules with the importance of the patient in mind that says transparency of healthcare systems to the patient among health systems, that we should be sharing results amongst so patients don't have to duplicate results. But more importantly, it's your results. You should have them. You should own them. So you should get them as fast as they're available to you. This CARES Act came along, and starting in November of this year, so it just happened, the transparency is such that you may suddenly see if you have an electronic health record or your secure patient portal, you may get notified in advance of
before we do.
Yeah, and in some cases your x-ray result, your blood test result, and you may see lots of flags and be alarmed, and that's going to provide anxiety. And so I've told patients of mine specifically, no news is good news to a degree. You will hear from us, the nursing staff, the clinical staff, or me in a secure message if I want to alert you that yes, there's an abnormality, but we'll discuss it, because I don't want you to get more nervous before the visit. We may have to discuss something else, and I don't want us to get sidetracked. But if you see a flag that's off by a little bit, please be assured that I've reviewed it. I will always see it too, and I will take your care to heart and manage that appropriately.
Yeah, absolutely. I always tell my patients, don't sit there and worry about your lab results. Pick up the phone and call me or send me a message. And I always make sure they know how to reach out to me and that it's okay to reach out to me. It's okay. I don't care. I want you to feel better, and we're helping you through this. You shouldn't struggle alone. Well, I think we have one last slide, and then we're going to go on to some important questions, hopefully. And I have some questions of myself, but yours are more important. But don't forget to de-stress during this pandemic. You've heard it. I can't assume that any of you have logged on to any recent webinars with Dr. Jury or Dr. McHale or Dr. Cole or any of us. But really and truly, wash your hands, keep physical distance, not social distance. So keep socializing, but try to physically be distanced, take walks, eat your veggies, and don't forget that connecting virtually can be the same as in person. Establish that relationship for good or for bad, and especially because we're in a comfortable environment, you might be in a comfortable environment, I think it's so much better. If you have questions and you don't have a local support group, again, I think everybody can benefit from reaching out, and maybe you're in an area that you couldn't physically drive 50 miles to a support group. Robin Toohey is on the call today, and she is the Vice President of Support Groups, the Grand Poobah of support groups, I call her. But if you don't find one on myeloma.org website under support groups, you can also call the myeloma info line as well. So in conclusion, virtual visits can produce anxiety, but trying to establish a connection and a rapport with your provider and your treating team is super important. You can get on-demand visits if you're sick, or you can have planned in-person visits. And really the insurance has been so relaxed, and I don't see any change in that in sight. And sometimes it might be a $40 or $50 charge, but then you're not driving all this way and taking time off of work. It's precious. And think of these as you would the office visits. And as always, don't be afraid to ask questions, be your own advocate, or have a caregiver speak on your behalf. And I think with that, I'm going to pause. Thank you so much for your kind attention. Thank you, Matt, for all your insights, and I'd like to answer any questions.
Okay, so remember everyone, if you do have a question, there is a little question box there. You could type your question right in and we will have it addressed today. And Beth, there was a question a little bit earlier on from Gail, who was wondering if you could talk a little bit more about the team, T-E-A-M, the team approach.
Absolutely. Gail, thank you for asking. The team approach, I think, is very important. You'll have your nurses, doctors, nurse practitioners, physician assistants, and then we have primary care people like Matt, and we also have the subspecialists. So knowing who's on your team and knowing who to call for what concern is very important. There are different expectations depending on where you're at. And so sometimes we want to make sure that if you have a cough or a cold, or if you think you have an infection, should it be your myeloma team to call, or should it be your primary team? So finding out all of these things in advance at the appointments is really important. I hope that answered your question, Gail.
A little bit of a follow-up on that, Beth. Gail is wondering a team approach for second opinions.
Aha, team approach for second opinion. So I am always 100% in support of a second opinion. And I think there's a lot of fear upon the patient. You don't want to feel, I hear this all the time, I don't want to feel like I'm cheating on you, or I don't trust you. And it takes a strong person to want to get a second opinion. But once you get that second opinion, then you can follow them. I saw somebody on Monday in a very, very, very remote island that doesn't even seem like they would be in the United States, and they don't have very comprehensive care. So they rely on telehealth visits even before the pandemic for a lot of their care. And I think this is a perfect time to reach out. A lot of our electronic records have communication systems set up. And so we can communicate, like, I have people that see, Dr. Nesvitsky and people in these big institutions that I can see their notes and they can see my notes, and the communication now is so much better. So yes, the team approach can work, and it usually does, and it's so important. One last thought for you as a patient to go, if you're in a small practice, to those large practices, because then that smaller doctor that takes care of everything can learn more about how to manage myeloma in 2020. I almost said 2000 in 2020 compared to elsewhere.
That island wasn't Hawaii.
It wasn't Hawaii, though.
No, I'm kidding. I also will point out that the team includes, primary doctors like me, because I will take, the ability to use telehealth to do what we call provider-to-provider consultation, like for second opinions, because we can use our own ability to do communication to the experts like Beth and others to say, we have a patient getting care already, what would be the next step? If I see abnormalities in my patient's labs, I can actually reach out and say, what is the next step? Do you want to see this patient, or when, or what should be done and how? And then they coordinate the next visit, and that next visit may actually be a virtual visit to start, and then we get the ball rolling. So think about it that there's all sorts of ways to think about the team in that approach too.
Yeah, that's important. If you don't want to feel like you're, stepping out on your primary myeloma team or your primary cancer team, maybe reaching out to your primary care doctor. I know I've had quite a few, he's interjected in other ways too, saying, no, go and get a second opinion on your lymphoma treatment or whatever kind of cancer you have. We want you to feel confident in your care team, and sometimes there does need to be a change. So we'll stop talking and go to the next one. Thank you, Gail.
So we have a question from Paul. He said, for someone with myeloma, what diagnostic home equipment would you recommend? You were talking about taking your temperature and your pulse. So what are the things you would recommend?
That's an interesting question. And Matt, do you want to?
Well, so though there may be some specific subtleties for someone with myeloma, I think, in the age of what in telehealth, this is where telemedicine and telehealth are a little different. But in telehealth, one piece of it is what we call remote monitoring, where you can get a Bluetooth scale to monitor your weight. You can have your temperature. You can check your oxygen level. You can have the blood pressure and blood sugar. Like, those are the big five. I guess the questions that come up is, depending on where you are with your treatment, some of the treatments, side effects might include fluid retention. Some of them might be that they spike your blood sugars if you have diabetes. Some of them might be they spike your blood pressure. So, and some of them, if you retain water and they, exacerbate your congestive heart failure, you might find that your oxygen level goes down. So I guess it's, I'm not suggesting that you go ahead and find a device that gets all five of these, but depending on what you discuss with your care team, it might suggest that based on where you are in your treatment, you might find that all you need is just a scale that you can just monitor your weight and maybe a temperature, because if your counts get too low and you get a fever, that might be the most important thing that you need, and that's it. Other people might need a blood pressure cuff and a blood sugar monitor. So it's going to vary. So I think it's that discussion that you have up front as part of your questions that you write down to have with the care team is important for you on your journey of where you are during your treatment.
I agree 100%. Thank you.
Okay, that was a great question. It was very helpful. So now Gary is asking, advice on how to get labs done remotely. Do you use a private lab that's available close to the patient?
Yeah, that's a great question, both Matt and I, because Matt actually monitors a lot of myeloma patients as well, believe it or not. He's kind of forced to, but we share a lot of patients. But I use labs that are close to the patient. It does not make sense to go 4-hour, 3-hour, 2-hour, even 1-hour drive to get labs in many cases. And so I try to find the closest lab. And then I also at the very beginning try to get a comparison lab. Nowadays, most labs are what's called CLIA certified, CLIA, and so they have certain basic standards. So the machines are much better calibrated than they were 10 or 20 years ago. So if I get somebody's M-spike and free light chains in West Virginia, at another time I'll try to get it at Cleveland so we can compare those apples to apples. Sometimes they tend to be oranges depending on the lab, but most of the time it's pretty consistent. Then I try to consistently use that lab as long as they are CLIA certified. Most of them are. Imaging is another thing. If somebody has pain, I have them go get an X-ray or an MRI or the appropriate imaging, and I try to get that done locally and then have the results sent to me. Again, we want to make this easy on you and balance that monitoring of your health condition without burdening you.
Yeah, great question. I totally agree. One thing I can even add here is that we've looked at a way, because of that Cures Act, of trying to make it as easy as possible for you as the patient. And so there are some national lab chains that are making it easier to even integrate into the electronic health record. So they're working with the biggest electronic health record organizations nationally. And so Quest and LabCorp and others that are well known, that's easiest for you as a patient. If you live hours away, instead of driving to the health care system you go to, it may be more practical for you to go 5 miles down the road and get your blood test, and either they could be old school 1970s fax, which is quite fine, or it may even be integrated into the health system's electronic
A lot of times
it has become, and that's the new way it will become. And so we're respectful of that. I think that's very important.
And yeah, and talk to your care team. I think a lot of people have this misconception that you have to get labs in our health system. Like, we're so fortunate that the Cleveland Clinic is in a lot of different areas that are accessible to our patients, like some satellite or subsidiaries, but that's not everybody's experience. But talk to your healthcare team and ask them, do I really have to drive up an hour and a half away just to get labs? How important is it really if I'm in remission and I'm feeling good, especially unless there are major changes?
So helpful, thank you. And Matt, could I ask one more time when you're speaking, if you could come just a little closer? I'm not sure if the audio is being picked up for you as well.
We were going to do headphones, Robin, and we couldn't figure out how to both wear headphones. I'm so sorry.
I'm sorry about that.
No, I think you're a couple. You need to get closer together.
Will do.
All right. See, there's an excuse to stay close. So we have a question. Maybe Matt, this would be something more interesting for you because I think you're from Canada. And so this woman says, I live in Canada. So where or who can I contact for a second opinion?
Well, great question. So depending on, it may be a dual answer, and I'm actually a dual citizen, so I guess I'm going to have a cop out. The answer is depending on where you're located. It may be well within your reason to seek care, as many Canadians come down to other places, across the border to get an opinion. There are really many good facilities, depending again which province that you're in, to get an opinion outside of your province. Many provincial governments are really somewhat restrictive on wanting the care to be delivered where it is. But that doesn't mean that this is your own personal health, and it doesn't mean that you can't get an opinion to say, is the diagnosis correct? Is the treatment plan correct? And the medicines I'm getting correct? You can get that anywhere. That doesn't, just because you live in Canada. I lived in Winnipeg, so that's where I grew up. I'm right in the center. Root was in the center. Doesn't mean you can't get an opinion to see if all those pieces are in alignment. You still may choose to get that in Winnipeg or in Toronto or in Vancouver or in Nova Scotia and Halifax. But you still could get those care pieces. I think Beth.
Yeah, and I think Myeloma Canada does a great job, just like the IMF in the International Myeloma Foundation that's sponsoring this call. It does a great job at connecting people. If you're asking about a second opinion over the border, you can simply just call. A lot of the places will have what's called a cancer answer line or a new patient line. For example, the Cleveland Clinic has a generic 1-800 number, and ask about the ability to see people. Now, you can't drive across the border because it's closed, right? But you can just call the hospital or the institution if you wanted to go out of Canada. But we have so many wonderful Canada myeloma specialists. Now Dr. We have all over. So, and we could take this offline. We could talk all night. But yeah, you should be able to contact Myeloma Canada or seek online at some of the centers of excellence, McGill and all those other, Alberta.
And I'll just follow up that though there are rules across practicing, we have challenges in the United States across, practicing across state lines, crossing country lines. If I am to give you a decision around treatment, there are some rules around provider to provider with a patient, and there's some nuances around that, but it's not a reason to get hung up and say, I won't even get that opinion. It's definitely within your right to look into that, and I think it's fair to consider that, because I think it's a possibility and should be looked into. So yes, it's, people get, the border's closed, I can't get care, I can't get, I can't cross into Niagara Falls or wherever else we want to go.
Well, thank you for that important question. I think finding providers is a big concern for a lot of people.
I know at the IMF, the info line does have a listing of myeloma specialists that are taking virtual second opinions and doing lots of course, the telehealth. So absolutely contact the IMF info line. I'm not sure if we gave that number out yet. So that's 1-800-452-2873. And you can reach Missy or Paul or Judy, and I'm sure that they could help you. And I'm sure the same is for Myeloma Canada with the woman who asked about our Canadian friends there. Now, we're getting close to the end of the hour, so this may be our last question. I'll see if we have time for another, if we could squeeze it in. But Marilyn asks about how can we reach our doctors after hours? So that, would it be the emergency number to contact, or would it be a virtual or a phone appointment? She says in the middle of the night or on the weekend, that's when I seem to need my doctor. So is that more of an ER visit?
Marilyn, that's an excellent question. So when that's about setting expectations with the healthcare practice that you're in, the first time people come to see us, we have doctors, nurses, etc., and we tend to give them a phone number. So Monday through Friday, 8 to 5, you call our office number, or we have electronic system that we can all communicate with as a pool. But then after 5 p.m. or over the weekend, there tends to be a hematology fellow on call or a physician on call in many practices. So if you're not sure who to call, and it might not be your doctor, it might not, but there are some other very capable people that are likely on call. In our area, we're fortunate to have urgent visits available all the time. What about the urgent express care line?
So we have a service that's 24/7 that people see us for urgent symptoms. And for right now, it is often people are concerned about COVID, and it's 24/7, and it's very busy, and understandably. But we also have people who have flares of their conditions and not sure where to go. Do I go to the emergency room? Do I wait and see or speak to my primary team? But it's also helpful because we have a new term that was developed out of this called the virtual list. And honestly, that our nurses will sometimes call us and say, the patient has called us because they're concerned that they may have something. And if, we connect with them, and we often can say, no, you don't need to go to the emergency room tonight. You might need to increase this dose or take a this, or this seems like this, but it's probably just a reaction. Take a this for tonight, and then reach your primary team tomorrow. And we communicate as part of the team because we're integrated. And so those are the ways to think about doing it. You will get numbers generally to reach out to your team after hours, and take advantage of that. And that will be the way to kind of keep it in the loop without having to go to that higher level of care if you don't need it.
But sometimes they have like Teledoc, and see like in your state or your region, there are telehealth providers that are very common wherever you are, if it's not with your health system. So we have a health system, a whole department, but Teledoc is one of them. There's other ones that Matt knows about.
Yeah,
you can always do that. If you don't want to go to the ER at 2 in the morning, but you're really concerned about a symptom, then absolutely reach out to one of those services. And a lot of times with Medicare, those are covered for an acute visit.
And in fact, some commercial insurance has one related to your particular insurance that says use Teledoc or Amwell or MD Live or Doc on Demand. I mean, I can keep going. There's probably 30 of them. But the point is that there may be one affiliated with your insurance or with your health insurance.
Thank you, Marilyn.
That was great. All the questions have been wonderful. I'm glad we've had so much time to chat with you both tonight more about this. I think the information is going to be extremely beneficial, especially as we navigate through these new ways to connect with our entire healthcare team. Remember, it's not always myeloma. You have to get those checkups for all the different things, your annual checkup, go to the dermatologist, your dentist, all of these different ways for us to make sure that our health is maintained. So don't forget to, Beth, go ahead.
I was going to say one more thing real quick. If anybody has any questions, they can contact after this presentation, the info line that you just cited. And Matt and I would be happy to answer any of your questions. Maybe they'll be viewing this afterwards. And so just know that you can reach out to us.
Oh, wonderful. So we will compile additional questions and we can always send them to you and get back to the patients and caregivers out there to make sure they understand all the benefits and the how-tos to make sure that they navigate through. Well, this really has been wonderful. And I gave the phone number out before, but again, that info line is 1-800-452-2873, or you could email them at infoline, all one word, at myeloma.org. So keep those questions coming. They're so important, and that's how we continue to learn and stay empowered. So I want to thank you, of course, both Dr. Beth Faiman and Dr. Matt Faiman. You really are the fabulous Faimans, and we're so thankful for you to share your time with us tonight. And I want to thank everyone out there that took the time to join us and participate. And we hope that this helps you to stay informed and continue to have those important conversations like both Beth and Matt talked about tonight. Those conversations with your healthcare team are so crucial. So keep doing that. Stay well. And again, thank you to our sponsors to continue to make these valuable Living Well webinars possible. And tonight we thank Bristol Myers Squibb, Janssen Oncology, Oncopeptides, and Takeda Oncology. And thank you to both our doctors and, of course, all of you for taking the time to join us this evening. And we wish you a very nice rest of your day.
Thank you. Bye. Thank you for joining.
Thank you.